These are the lower limb sensory points according to the ASIA, the American Spinal Injury Association. You can test the function of your lower extremity nerve roots according to these key sensory points. T12 is at the midclavicular line over the midpoint of the inguinal ligament, shown with this green dot here. L2 is on the anterior-medial thigh, shown here at the midpoint drawn on an imaginary line connecting the midpoint of the inguinal ligament, which was T12, to the medial femoral condyle, which is down here. So halfway between here and here will be L2. Going back to L1, it's midway between T12's point and L2's point. So halfway there next to the groin, next to the genitals. L3 is at the medial femoral condyle above the knee, demonstrated here and also with this dot here in the blue region on this image. L4 is over the medial malleolus, shown down here. You could also draw it on this one as well. L5 is on the dorsum of the foot at the third metatarsal phalangeal joint, so that's shown down here, L5. You could also draw it down here as well. S1 is on the lateral aspect of the calcaneus, shown down here. You can also draw it down here as well. S2 is at the midpoint of the popliteal fossa, shown down here, also visible from the back of the leg, and as well as the side view here. S3 is over the ischial tuberosity, or the infragluteal fold. This is patient dependent, so S3 is here. And then S4 and 5 is in the perianal area, less than 1 centimeter lateral to the mucocutaneous junction. Now, an alternative to test for these nerve roots would be motor function. So L1 and L2 primarily control flexion of the lower extremity of the hip. L3 and L4 primarily control extension of the knee and the patellar reflex, and flexion of the knee is controlled mainly by L5 along with S1 and S2.